Hello and welcome to today's episode of the Pediatric Consult. I'm Dr. Jill Schaffeld, your host for today, and I'm very excited to talk to today's guest, Dr. Richard Whitney from the Ohio PHP, which is the Professionals Health Program. Today's discussion is about what to do when a provider needs help. Let's talk a little bit first just about our guest, Dr. Whitney. Welcome. If you could tell our guests a little bit about yourself, maybe share a few sentences about your background, about the Professionals Health Program itself, maybe how long you've been practicing, and then any special interests you might have.
I'll be happy to. Thank you so much for asking me to be here so I can share some information. Yeah, I've been in medical practice for 47 years. 35 years of that has been in the field of addiction medicine. And about 4 years ago, I was recruited here as medical director of the Ohio Professionals Health Program. Before that, I was medical director of a treatment facility called Shepherd Hill over in Newark, and I would refer all healthcare professionals here for monitoring after they finish treatment, and now I'm on the receiving end of those referrals. The Ohio PHP itself has been around for over 30 years. Like I said, I've worked with them for going on 20 of those years and very happy to be here.
Wow.
We just changed our name a couple of years ago from the Ohio Physicians Health Program to the Ohio Professionals Health Program to reflect the fact that we now work with a lot of licensees of licensing boards in addition to the State Medical Board of Ohio.
That's great. Thank you for being here and what an extensive background you have in this topic. So very excited to kind of get into things and do maybe something that just seems a little bit different than oftentimes what we do on Pediatric Consult. So often we're talking about just a specific medical issue and how we deal with this. But, it could be kind of thought of as the same. This is mental health and kind of the whole body. And I always think that we as providers need to make sure that, we're doing well and we're healthy in order to treat our patients. So thank you. So let's start just talking a bit about the big picture. How common is substance use disorders among healthcare professionals today?
Well, as I speak to professional groups, what I usually remind people is to go home and look at their birth certificate, and they'll see there's no letters after their name. In other words, we are human beings first, and physicians and healthcare providers later. So the incidence of substance use disorders, specifically in the healthcare population, physicians and others, is about the same as it is in the rest of the North American population, which is about 12 to 14%. Now, in addition to that, of course, as of October 1st, 2023, the State Medical Board of Ohio created the Confidential Monitoring Program, and we are now allowed to work with healthcare professionals, licensees, with not just substance use disorders, but primary psychiatric or mental health conditions, and in fact, in addition to that, physically impairing conditions such as post-stroke conditions, auditory or visual limitations, and so forth. But substance use disorders is the condition that established most PHPs around the country, including ours. But something like 1 in 7 healthcare professionals at some time in their life will be diagnosable with a substance use disorder.
Wow. I think that's, I don't know, shocking and not shocking all in the same. So, but just to, like you said, realize we're all people, right? And we all have different stressors, just kind of depending on, our lives in general, but also just with our profession. So what would you say are some of the main drivers of distress in the healthcare field, maybe leading to some of these substance use disorders?
Well, there's high demands in our field, obviously. There are intensely emotional situations, exposure to suffering and death, my golly, especially in the pediatric field, watching children suffer. Concerns about our own physical safety, such as catching COVID, HIV, or hepatitis. There's a lot of us that have prolonged occupational stress. My original field was emergency medicine. That's quite a stressful field.
Absolutely.
And it leads to a lot of energy depletion, sometimes cynicism, and thoughts of leaving the field, which leads to professional burnout. There's moral distress because a lot of us can feel unable to act in accordance with what we want to do because of financial restraints or other restraints and limited resources. And all of this can lead to intense stress, depression, anxiety, professional burnout. And for those who are genetically predisposed and have an abnormal reaction to mood altering drugs, we can overuse alcohol, benzodiazepines, opioids, and other mood altering drugs that lead to a substance use disorder.
Absolutely. And I think you touched on this just a little bit in what you mentioned, but what are the main factors that you say are so important for healthcare organizations to really take this issue seriously and maybe not just for the individual, but for the system as a whole?
Well, again, not to blame any system because hospitals and major medical systems have a lot of responsibility. They have to stay open and make enough money to pay salaries and keep the building open. But at the same time, sometimes it's real easy to believe that a fewer number of nurses and doctors can do the same job in order to save money. We also expect sometimes healthcare professionals to take care of a greater and greater number of sicker and sicker individuals, sometimes with extended shifts over time, without an idea of what it's like to care for these individuals for a long period of time and watching them suffer and continue sometimes to deteriorate. It puts a lot of pressure on healthcare individuals. Fortunately, there are some organizations and conferences like the American Conference on Physician Health that is upcoming next month, a conference in Boston I'm going to, that hopefully will help organizations to know how to take care of the most valuable resource they have, which is their employees, doctors, nurses, physical therapists, aides, and others that actually care for the patients. So I don't believe that administrators of major health systems are slave drivers or necessarily trying to overdo it individuals, but sometimes it's difficult to remember that taking care of the sick and dying for 12, 14 hours in a row can really bring about a lack of ability to provide self-care. I don't need
Yeah.
to go to the bathroom. I don't need to eat
Right.
because I need to be here for my patients.
Sure. And it makes sense. And, maybe you don't always think of it that way, but, it's running a business, but how do you keep that business well and thriving and the people there happy and wanting to be employed by you?
Exactly.
So let's go ahead and jump into a little bit of kind of the nuts and bolts of what can we do. Uh, could you tell us a little bit about things we should watch for as physicians, as mainly pediatricians listening to this, that might be early warning signs that a colleague could be struggling with burnout, mental health issues, or even substance abuse or substance use?
Well, it's first for professional burnout. Three of the major initial symptoms for the diagnosis of professional burnout, which now has a World Health Organization diagnosis of it as of its own. It leads to feelings of energy depletion, fatigue, increased cynicism and negativism related to one's job, and then feelings of reduced professional efficacy and thoughts of leaving the field. Those are the three primary diagnostic symptoms. So if we feel like I just can't go in for another day, why did I ever come into this field? Maybe I should be a welder or a truck driver instead. Uh, those should be thoughts that trigger maybe I'm reaching the point of burnout. Maybe I need to practice a little more self care, take breaks a little more often, and find somebody that I can talk to about the intense, stressful situations in which I find myself on a regular basis.
Absolutely. I was thinking as you were saying that, do you have any pearls with how to tell the difference between someone just having a bad day or someone who might need real support and just maybe, I feel like we all work with so many different types of people. There are some people that maybe just are a little bit rougher around the edges or, don't have that bubbly, happy personality. How to differentiate between, hey, a little bit of that is just them, or maybe that isn't them, but they are just having a bad day and it's not part of a bigger problem.
Well, obviously, everybody has periodic bad days, but when the behavioral changes become sustained, they're worsening instead of getting better, and colleagues have concern, then expressing that concern is warranted. A lot of us are afraid to say, well, Are you having problems with depression or something like that going on? Because we're afraid of making a mistake or hurting someone's feelings. But we wouldn't do that for one of our patients. Why would we do that for our colleagues? If we're having signs and symptoms of distress, conflict, or problems that are sustained and problematic, then we need to have the courage to step up with care and concern and address those in our colleagues.
Absolutely. And you touched on this a bit in terms of signs to look for with the excessive cynicism. But are there specific signs that might be more likely to show up in the workplace versus in someone's personal life at home?
Well, certainly showing up for work with a hangover, alcohol in one's breath, appearing to be under the influence of a mood altering substance, complaints by others of the healthcare practitioner's behavior, especially patients that say, "What's going on with Dr. Jones? He's just not been himself lately." Showing up late for shifts on a regular basis, avoiding participation in events, drinking heavily at hospital sponsored or medical staff sponsored events can sometimes be an early indicator of an alcohol use disorder. Frequent bouts of anger and irritability on the job. Those generally are not considered to be acceptable in nurses and doctors and other healthcare professionals on the job. And they can indicate not that this person is a bad person, but they might be developing a disease, whether it's depression, anxiety, or a possible substance use disorder.
I think those are great, very matter of fact examples of really what to look for. You mentioned that, when we think about these things, we would have no problem asking our patient, hey, are you depressed? Are you having problems? But we seem to be a little bit more intimidated to ask a colleague or a coworker, which, sometimes those things can be hard to talk about. But what's the best way? What are some real good, just concrete tips of how to start that conversation, how to make that feel a little more approachable and easier for us to kind of ease into maybe what can feel really tough to start?
Really great point. First and foremost is to prepare. What am I going to say? How am I going to come across? Bring up specific points. When you came into work last Friday, you definitely had alcohol in your breath. You've been calling off more frequently, so specific points that we can prepare in advance to make sure that we know what we're going to say. Number two is to make sure and have a confidential location where this conversation is not going to be overheard by coworkers or supervisors because we want to respect the individual's confidentiality. Um, and making sure that our tone of voice is one of care and concern, not blame, not anger, not finger pointing, but saying, Joe, I'm really concerned about you because you have been showing up. You just don't act like you did before. And when the last time we were together at a medical staff function, I noticed that you had 4 or 5 drinks and were a little intoxicated. Is that going on at other times? Expressing that concern is real important, but also leaving time for the individual to respond. A lot of times we are going to be afraid of, oh my God, what if I make them angry? Well, anger and strong emotions might be common, and the point is don't let that get under your skin. Listen very carefully, practice active listening, and let the individual tell you what's been going on. Make sure and respect confidentiality. Don't repeat anything outside of that room that has been told to you without their express permission. But care and concern, make sure you're at eye level and not talking down to them. And it can turn out to be a life-saving or career-saving conversation.
Absolutely. Those are great points. I think you kind of, I was going to ask you about any common mistakes and how to avoid them, but I think you just touched on that private conversation, active listening, coming from, care and concern, not talking down to the person. Those are all great points of how to really physically have that conversation and make that easier for, a very personal and touchy subject for many. So how would you respond if the person denies there's a problem or seems to become defensive with you?
Well, it could be, okay, let me ask you about how you're feeling right now. Do you feel like I'm really off off base here? Or is there something you might want to discuss a little bit later on? Let's get back together at lunchtime on Friday in my office. We'll close the door. Maybe we can talk a little bit more about it because I think that there might be a little more than going on than is coming out today. The focus must be on controlling my own responses, my own tone of voice, making sure that I don't get too angry or defensive or saying, "What's wrong with you? I'm telling you the truth here," coming across as care and concern, but give it a bit of time for what you said before to soak in, but set a specific time and a place for another meeting to see if they want to talk a little bit more about it. Always make sure to have resources available for the individual to use. Have you considered contacting Ohio PHP? In some medical centers, have you considered contacting the EAP? Sometimes the individual might want to use local resources in the hospital. Sometimes they want to reach outside, so there's no chance of that information getting out. But having ideas, phone numbers, websites, and other suggestions can be a real helpful um, addition to having that conversation.
Absolutely. Um, and that kind of leads directly into what I was hoping we would continue to discuss, which is perfect, is how to connect that person to help. So have those resources available. Make sure that you know kind of where to guide them, because I think that will help that person realize that you are there to help, right? You're not just accusing then with no, you know, I don't know how to help you, but I think this is a problem, which sounds much different if, I'd like to help you. Here are some resources that I thought about, maybe these would be useful for you. But when someone is truly ready to get help, we mentioned those resources, but can you explain a little more in depth what the physician and professional health, like Ohio PHP, the physician health programs are and how they work?
Yeah, PHPs have been around for a long time, and almost all of them started as physician health programs exclusively geared toward helping MDs and DOs. In a number of states, including Ohio, we've also spread to including other healthcare professionals and indeed, in addition to physicians. Also, the great majority, essentially all PHPs, work with identified healthcare professionals with substance use disorders. And again, some PHPs, like us here in Ohio, have been allowed to statutorily stretch out our resources to be able to assist with psychiatric or mental health problems and physically impairing conditions. So whether it's a physical problem, a visual problem, amyotrophic lateral sclerosis, Parkinson's, possible dementia, or whether it's a substance use disorder. I should mention that a lot of people believe that physicians have substance use disorders because we have access to drugs. But still, the vast majority, 75 to 80% of healthcare professionals, have alcohol as their primary or sole drug of use, which of course is available to any adult. Mood disorders such as depression, anxiety, possible bipolar disorder, or cognitive issues, we also deal with at Ohio PHP. But we made our reputations on treating substance use disorders, or I should say, referring to treatment. What we do here at Ohio PHP is take an initial call, and all referrals are kept absolutely strictly confidential. So nobody has to worry about us disclosing who made the referral. And people obviously can self-refer. Then we get that information, we talk to the individual directly, and we schedule them for what's called a well-being screening here, either in our office or by Zoom. And we do screening tests to determine if there might be an issue that would fall under the umbrella of what's called the confidential monitoring program here. So you don't have to make a diagnosis yourself when you are talking with a colleague. Send them to us. Our number is 614-841-9690, and simply say, I have a possible referral, or I'm referring myself. And that will go to what we call our IST, or intake screening and treatment team. And more information will be gathered, and usually a screening will be scheduled. Now, there are other options that people can contact. We also administer the Columbus Medical Association's program called Doc to Doc that is now on our website. And physicians who would like to speak to another physician in their general field of practice, such as stressors from a professional liability suit or questions as to how to handle an increasingly busy practice, they can talk to somebody who's specifically trained, and we can connect individuals to there. So it doesn't have to be a diagnosable medical condition either. If someone is actually having thoughts of suicide or self-harm, obviously the emergency department or calling 911 or 988, which is the suicide helpline, is an optimal measure. But most of the time, if it's not a medical emergency or possible suicide, if the first call is to us, I can guarantee we will either direct you to the right place or we'll tell you who to contact.
Perfect. And does every state, because we have, even though we're based out of Cincinnati, Ohio, we have broad listenership. And does every state have a PHP, or the majority of states, just kind of thinking more on like a national level?
47 states have a PHP.
Wow.
The three that don't are in the process of forming them. Most people are surprised that one of the big states that doesn't have a PHP is California.
Oh,
But that's for historical reasons. It was shut down
interesting.
about 15 years ago, but it's being reformulated. But 47 of the states, we have a national organization called the Federation of State PHPs and meet annually and on a regular basis.
Great.
I'm on the board of directors of that organization. And we try to standardize as much as we can how PHPs work around the country. But sometimes PHPs are attached to the licensing board. We are an independent 501c3 and have a contract with the medical board and other licensing boards, but we are not part of the licensing board. So people don't have to worry at all about calling us and disclosing what's going on. The only obligation we have to report to the medical board and other boards are sexual boundary violations. Statutorily, we have to report those. But substance use disorders, mental health conditions, physically impairing conditions, we keep those completely confidential.
That is a great point. It's wonderful to hear that really there are many options in all but 3 states, but hopefully every state soon. But also, I think what you touched on there was so important, because maybe so many people who may seek help for themselves may be scared that it could jeopardize their license or their career. And that's a huge stressor as well. So you're dealing with, the burnout or the substance use. But then on top of that, thinking, I'd love to have help, but, what do I do that's not going to cause this cascade of other problems in my life? So thank you for touching on that.
Very important point. And what people have to keep in mind is that left untreated, then substance use disorders and other conditions may lead to problems with licensure. So by contacting us early on and getting in the confidential monitoring program, we can prevent that from happening. We currently have 500 licensees under monitoring contracts. The great majority of those are licensees of the state medical board, but other boards as well. So we have the vast majority of those have confidential contracts, and so long as they follow directions and are doing well, we are under no obligation to make any report to any of the licensing boards.
Perfect. And that's, I think, great to hear for our listeners, and then, to be able to share that if we're reaching out to a colleague to help them. What would be one thing, and this is kind of a unique question, but one thing that you would tell every listener today that they could do to really create a more supportive culture within their workplace?
Brain diseases should not have stigma and shame associated with them. Society for millennia have stigmatized and shamed people who have brain illnesses, such as substance use disorders, depression, anxiety, mood disorders, or cognitive disorders or other conditions. And if we can somehow look at it just as we would pancreatitis or fractures or appendicitis or a sore throat as medical illnesses that can be effectively treated and should not be stigmatized. If we can just get over that stigma, then I think that would eliminate so many of the barriers that people have about seeking help. We in medicine have, unfortunately, kind of a tough, we can take it, we don't get sick like other people, and I'm not going to admit that I'm weak and need assistance. And that can be fatal. People with severe depression need to feel completely fine about reaching out for assistance, just as they would about chest pain or abdominal pain.
Definitely. What a great point, because you're right. We don't always think of that, as a similar disease, and it really is. So, where can our listeners go to find more information or more support for themselves or a colleague? I think you touched on some of these things already, but just kind of thinking back to, and some of these we can actually attach as a link to the bottom of our podcast page here for our listeners, which would be wonderful.
Well, the first place that I would encourage people to check is our website, which is www.ohiophp.org. And we have a lot of resources. We have links to each specific licensing board and their safe haven program. They're all called safe haven programs, except the medical board preferred the term confidential monitoring program, but it's the same. Another very important website is wellbeingcares.org, which is a link to a free, completely anonymous, de-identified suicide screening questionnaire that comes anonymously to one of our master's level counselors to score, and then they can exchange de-identified messages and get referrals if they really need help, if they're suicidal or at least having thoughts of self-harm. Again, the www.ohiophp.org, and then putting in doc-2-doc. We manage the doc-to-doc referrals for physicians who are looking for somebody else who's been trained that can kind of help them for practice conditions, such as the stress of a liability suit or possibly being bought out by a big organization, completely anonymous, and we'll hook up one doctor to another doctor. Other resources, such as links to Alcoholics Anonymous, Narcotics Anonymous, and other wonderful organizations like that, can also be found on our website.
Great. That was perfect. I think lots of good resources. So from there.
Well, my favorite word to bring up is confidentiality. Calls to us are kept confidential. We will not disclose the name of anyone working in our safe haven or confidential programs. Again, with the tiny exception of sexual boundary violations, statutorily we must. But other than that, everything is confidential. Who referred the individual to us, self-referrals, please feel free to contact us at Ohio PHP. It will go no further.
Absolutely. Thank you again for emphasizing that, because I think, like you said, it's a huge probably stressor or strain on people that, may want to refer someone or may want to seek help themselves. So I want to thank you, Dr. Whitney, to take a moment to thank you for being here and sharing your expertise with us on such an important but often very difficult topic to discuss. And I think you've provided us with some real strategies to use both personally and professionally within the workplace. So thank you. It's been wonderful, and we appreciate
Thank you for having me. I really appreciate the opportunity.